for your session.
Thank you, Sahayana sir, and all those participating in this session. Good morning, good afternoon, and good evening. Welcome to the 1721st day of continuous and uninterrupted Zoom session of IFPH. Let us start today's proceedings with a silent prayer for 1 minute. Thank you and welcome back. Today we have with us Professor Dr. RAJAT CHATTOPADHYAY, PhD, MD, MBA Healthcare. Principal, the Calcutta Homeopathy Medical College and Hospital, 20 years of professional experience, author of 3 books, one of which is Cardiology, published from BJ and others from IBPP. Resource person for NCH, CCH, CCRH, NIH, etc. And the topic is Clinical Medicine Recent Trends. So on behalf of IFPH, and welcome, sir. You can have the platform for the next 45 minutes. Over to you, sir. Please proceed, sir.
Dr. Manoj, I am making you the host now.
Yes, sir. Okay, okay, sir.
Now video is open.
Yes, video is opened. Yes, sir, please.
Okay. Hello. Thank you.
Yeah.
Thank you.
So, welcome.
Am I audible now? I am audible.
Yeah, you are audible. Yes, sir.
Yes.
Okay. Today's topic is recent clinical trends. So I want to share my PowerPoint also.
Yes, sir. You can.
Just 1 minute.
Okay.
Okay, sir.
Yes. Okay.
Yeah, it has come up.
Yeah. So it is clinical medicine, the recent trends, and first of all, that is what is overview of clinical medicine. Clinical medicine encompasses the study and application of health sciences, focusing on patient care, diagnosis, and treatment. Actually, it integrates the latest research findings with evidence-based practice to optimize patient outcomes. This is very important because whatever right now it is going on, that is evidence-based medicine, or before that clinical medicine, right now it is evidence-based medicine and maybe extreme medicine and to functional medicine. So various forms of clinical medicines, whichever is coming up, this is based on this evidence-based practice. It is of a research outcome on the basis of a good research. So importance of staying updated in an ever-evolving medical landscape. Healthcare professionals must continuously update their knowledge through ongoing education and professional development to provide the best care possible and adapt to emerging trends. These are the trends. Whatever emerging trends, like now, whatever the previous session it was going on CBDC, or whatever session is now the competency-based dynamic curriculum. The ultimate goal of this, just to remain updated with the ever-evolving medical landscape and healthcare professionals. It is not that homeopathy or Ayurveda or modern medicine. We have to, with the clinical medicine, we must have adherence with the clinical medicines. So it must have impact on patient care. Recent trends significantly enhance patient care through the implementation of advanced technologies, personalized treatment, individualized concept. But the personalized concept little bit differ from our concept of individualization. But in the broad sense, in the crude sense, the individualized concept and this personalized concept, in a big sense, it is more or less synonymous. So I will go later on, rather the critical discussion regarding these, and the resulting in better health outcomes and patient satisfaction. So what are the advancements in clinical medicine? Number one, rapid advancements in clinical medicine, that is the evolving quickly this clinical medicine due to technological and research breakthroughs. You must agree with this, all of you, that the technological and research breakthrough is the pivotal part through which this clinical medicine will remain upgraded, and we also with those. So focus on personalized healthcare, integrating AI, the artificial intelligence, and data analytics to tailor treatments for individual patients. So the basic things of these individualized concept, whichever the homeopathic principles, the first one concept of that individualized concept, now in these personalized concept, or in these concept with AI integrated concept, the tailored treatments, that is, there is not a single medicine for all the individuals. Rather, for each individual, there are maybe a group of remedies, or maybe a single remedies, or maybe very little remedies for one individual which particularly fit. That is a tailored treatment. And shift from reactive to preventive care. We always know that prevention is better than cure. But healthcare models are now transitioning towards prevention rather than just treatment. It is obviously in our homeopathy. It was obviously in the earlier healthcare system of Ayurveda. It was a part of modern medicine, but of modern system of medicine. But right now, it is the main thing, that is the healthcare models transitioning towards the prevention. In not only is a part, maybe in the holistic point of view, and importance of patient engagement. Patients are increasingly involving in their treatment plans, leading to better outcomes. All the social medias, all these YouTubes, all these searching, all these AIs, all the innovations in this part. Now patients are very much educated. Patient are well aware about the different system of medicine, different system of medicine's principles. So they are well aware. Whenever a patient is coming to our chamber, right now the patients are very much not only education from general education purpose, but also from clinical medicine part. They are well aware from these social medias and all from these our technologies advancement. Ethical implications of technology. New technologies in medicine raise important ethical consideration that must be addressed. I will discuss later on. So these are the very new one, and we are very much familiar with these during COVID time. But since COVID, these two things, that is the telemedicine and this webinar or online education, these are the very we understood what the efficacy or what these were very if I am not wrong, maybe 2 to 3% were aware about this. But this telemedicine concept, it is how important. And this type of webinar and online treatment, online educations, these were not very well known, so especially Indian continent or in other continent, but they're in developed countries, they were well aware about this. But to Indians, in Indian context and on all other developing countries, these are very emerging concept. And we now understood that the advantages of all this. One is telemedicine. It is expanded access to healthcare through virtual platforms, and for rural areas, chronic diseases follow-ups, especially mental health support, because nowadays every individual in any stage of life become very alone. And with this telemedicine concept, even the counseling part, a very good case taking, even doctor-patient bonding, that can be built up even with these virtual platforms and through telemedicine also. Apart from the 1:1 face-to-face physical presence, these are the other forms in which we can excel ourselves. Now, telemedicine revolutionizing patient care. It is what is telemedicine? Refers to the remote delivery of healthcare services using telecommunications technology. Its exponential growth has been driven by advancement in technology and increased acceptance among patients. It is becoming very much popular. I can say about our state in West Bengal, apart from the physical, right now the number of patients in this telemedicine in all the good modern medicine hospitals and as well as homeopathic hospitals, these are very increasing in number. So we have to think about with these telemedicines. Benefit, what was the benefit for the patients and providers? Telemedicine improves access to healthcare, reducing travel time and costs, particularly for patients in rural or undeserved regions, in hilly areas, in very remote areas. These are the telemedicine's advantages. And furthermore, it enhances provider efficacy through streamlined workflows and increased patient volume capabilities. What was the challenge? The limitations must have. Despite its advantage, telemedicine faces challenges like technical barriers, right? There's the technical barriers through internet connections, limited access to technology, regulatory hurdles, concerns about the quality of care compared to traditional face-to-face consultations. But you think of whenever in the first stage, just 5 years or so, when we were thinking of online marketing, online sales, online purchase of anything, we are very much apprehended that what will be happening, whatever we will buy, that may not be very good in standard. We may be cheated like that. But right now, ongoing marketing is one of the part of our life. We cannot think without ongoing. Just like this, whatever the struggles, hurdles we have in these telemedicines, we can, with the time, we can point out what were the disadvantages, what are the barriers, what was the hurdles, and then we have to work on it, because telemedicine has got its unique opportunity, in especially in Indian context and in developing countries, to spread all these medicinal values of any system of medicine, from modern medicine to homeopathy to Ayurveda, all Ayush systems, to the remotest part of the country. And another two things, that is precision medicine and personalized medicine. It's a very new concept to general people, but as a homeopath, as a homeopathic professionals, we are very well aware about our individualization concept. We are very well aware about our miasmatic dyscrasias. We are well aware about our susceptibility concept and what are the accessory circumstances. So we are not, it is very new to us, the very basic principles, because very basic principles are synchronized with these precision medicines and personalized medicine, use of genetic, biomarker, lifestyle data, even MLD trust. That MLD trust, the life space, it was a part of MLD trust during or a part of case taking, which usually in general homeopathic principles, we usually take the past history, all the events in the chronological orders, the history of occurrence of diseases, the family history, even the past history of the present complaint. So all these is nothing but the lifestyle data to tailor treatments. So targeted therapies in oncology or pharmacogenomics in psychiatry, these may be a new concept to modern medicine. Suddenly, by seeing these, we can feel that our very basic principles are in the right line. So these targeted therapies in oncology, it also simulates to our targeted therapy to reach to the subliminum. To the subliminum with meeting of 5 or 6 or 7 points of reaching to the subliminum concept, that is the most subliminum medicine to that patient in that context at that time. So these are the new thought, precision and personalized medicine, which very much simulates with concept of our homeopathic concept. These are the tailoring treatments, personalized medicine, which I have already told, that genomics and patient data, and personalized medicine leverages genomic sequencing, patient data analytics to customize treatment plans based on whatever is written. It is just like expression of our homeopathic principles in the language of present context, scientific language, like individual genetic, environmental, and lifestyle factors moving away from traditional uniform treatments. So right now, whenever we have to treat one patient, whatever disease may have, the patient may have diabetes mellitus, patient may have cardiovascular diseases, patient may have rheumatoid arthritis, patient may have any type of chronic lifestyle disorders, even gout, hyperuricemia. We have to consider the patient at that time in his society, in his circle, just like taking the case to ask about the name, age, sex, religion, the schooling, his physical and mental makeup, his sexual relationship, etc., like our aphorisms of organon of medicine. So whenever we have to take the deeper part of his life, just to say, like life space, like personal history, like past history, so it is an attempt to make the patient, what is the uniqueness in that patient in that time during the disease state. So the condition of the patient in the disease state and how the disease evolved in the patient in that time or in a given period of time, that is we have to search out. Whenever we have to search out, the 50% case may be cured because patient can understood that doctor and patient bonding already developed. So these are the points. So case studies. Now, case studies was very important in the modern medicine during clinical part, final year part, to show the clinical part. But right now you see the numerous case studies showcase the effectiveness of personalized medicine across various conditions, illustrating improved outcomes through targeted therapies that consider a patient's unique biological makeup and response to treatment. This is a very important part because from homeopathic point of view, our case series study is one of our most important part in the research triad, in the research triangle. In the research triangle, usually case study, individual case study and case series study is in the last part. It is not like meta-analysis, like it is in the very highest part. It is in the lowest part. But now case studies or case series studies considered to be a very important one because in personalized medicine, these case studies or case series studies will be in a very higher stage in comparison to the traditional part. Future implications: the future of personalized medicine holds great promise in enhancing predictive analytics. Continuous. So what is this predictive analytics? If we can know the genetic, like in the present context, the genetic makeup, if we know the miasmatic dyscrasias, if we know the individual weakness, if we know the susceptibilities, then we can give a good advice to patient to prevent these so that the disease may not happen. A patient having very strong syphilitic background with the very past history family history with strong syphilitic background, having fatty liver, it may be due to alcohol, it may not be due to alcohol, it may be non-alcoholic fatty liver, it may also be alcoholic fatty liver. But having syphilitic background from miasmatic dyscrasia's point of view, if we understood the tendencies, then the pathology of these patient will go very fast. It is our prediction, and that prediction, it is not based on the 50-50 like that. It will work because it is based on the science, the human genomic concept based on the science. So whatever personalized data or data we are taking, the individualistic concept we are taking, on the basis of that we can predict that what type of disease may happen with that patient and how can be prevented by any means. It may not be prevented 100%, but a certain amount percentage, if it can be prevented, then the disease pathology may be slowed down. And with the constitutional treatment, it may happen that the patient, the disease pathology may be halted. So this type of thinking from modern medicine, that genetic markers will allow for proactive medical interventions and potentially revolutionizing the way diseases are managed, this basic philosophy is just synchronized with our concept of individualization, miasmatic dysplasia, constitutional tendency, and susceptibilities. Artificial intelligence and machine learning, AI in diagnostic imaging, radiology, dermatology, and predictive models for patient deterioration, sepsis, or readmissions. These are the part that we can predict that this patient will not be cured within this time, 7 days, or it may take time because the constitutional tendency is not allowing patient to cure within a very short time, or the constitutional level of the patient may allow the patient to cure within very short time or long time. This is depending on the patient's individualistic concept, individualization, or this is based on the patient's genetic mapping. It or maybe due to accessory circumstances, or in today's language, it is epigenetics. So the epigenetics or the accessory circumstances, the patient's particular individual constitution, and the present context, these are the deciding factors that how the disease pathology will progress. That will be slow or halted or very fast. It is depending on different factors. It is not that only single factors, that only miasm, only bacteria, only virus, or only one single miasm is causing all these. Multiple factors from one thing to another thing. Artificial intelligence in diagnosis, these are the very enhancing accuracy and efficiency. You must agree with this. AI applications in clinical settings, even improving the diagnostic accuracy, ethical consideration related to AI. These are the one of the very hurdles will come, and debate will be going on, and critical discussions will be going on with the ethical consideration, with the implementation of AI in all these things. But you must agree, or also my concept is that AI applications should be used, but ultimately before implementation of that, also that can be corroborated with the human knowledge and with the human cross. That is, we have to make a cross trial also, and cross trial will be with the machine, with the human brain. We admit that the machine accuracy will be much more better or efficient than human brain, but ultimately, just like unintelligent vital force, also the AI also, we have to admit, it is also the part of unintelligence may be there in very many cases. So it may be very good one in very routine part, but in individual way, in a very chronic disease which is not very familiar, in that case AI may not predict. Also we have to consider this, because lifestyle disorders, it is not will confined with only diabetes or hyperuricemia or cancer or cardiovascular disease like that. There may be very many, so many type of, within the psychological conditions, the psychiatric diseases, in the neurological mania, you know that more than 80 varieties in the autism spectrum disorders. So if within autism spectrum disorders, so many varieties, so within the psychiatric level and within the lifestyle disorders, there are so many varieties, and permutation combination will be going on. So it will be impossible to make the AI accurate in everything. So we have to corroborate it with the human knowledge and their sense, because in sometime in clinical medicine, it is said that the artistic thinking and the common sense are the two very basic important thing in clinical medicine to diagnose any disease. Wearables and health monitoring devices, that is the continuous monitoring of vital like ECG, oxygen saturation, glucose, helps in early detection of arrhythmia, sleep disorders, etc. These are from AI point of view. Wearable technology, remote monitoring, this is a one very good advantage of this. Whatever by any type of watch, that watch can take care of your heart rate, watch can take care of your pulse rate, whatever is a recent trend in clinical medicine. There may be advantage, disadvantage, because most in many of these remote monitoring may not be accurate always, and always there may be 10 to 20 variation in with the normal data. But whatever, the patient remain very much health concern. This is the one part, that is patient remain very much adherence with his heart, with his pulse, with his vital statistics, everything, because patient wearing something related to heart. So it is one of the advantage that in the health management, now patient are very much conscious about their responsibility, their accountability. So this is one thing. And another bad thing, that is the type of, from homeopathic point of view, the carbonitrogenate constitution type of patient, the very apprehensive type of patient, very nervous type of patient. These type of patient will having anxiety with wearing with these weapons, that something may happen, and whatever it is happening, it may have their like habit spasm, minutes checking, hours checking of their heartbeats and BP and etc. Just whether I am okay or not. So these type of anxiety disorders also may come from these innovations. So there are good and bad things both. mRNA novel vaccine technologies, these are the part which is going on, the ongoing research into universal vaccines. So many vaccines are coming now applied to RSV, flu, cancer, even the genetic for female cervical cancer. This is one important part where homeopathy can do a miracle, like antimicrobial resistance, increasing global threat. And even from World Homeopathic Organization, WHO, they also repeatedly, they are warning us that this may be the increasing global threat, when not a single medicine, single antibiotic will, or antimicrobial, not a single medicine will work. So these we have to renewed focus on antimicrobial stewardship, new antibiotic classes, bacteriophage therapy from modern medicine point of view, and how these antibiotic resistance spread from man to a field to through animals. These are the how antibiotic resistance spreads. There are so many causes of antibiotic resistance, and these type of people will have no medicine, and these type of people will go to these alternative therapies for their treatments, for which we have a very good constitutional treatment. So these microbiome research and therapies, there is a link between gut microbacteria and systemic diseases. You see the obesity, irritable bowel disorders, mental health. Usually it is in Naxbhumika or in West Bengal, in eastern part of India, it is so many patients we have observed related to abdomen. They have been suffering from amoebiasis. Entamoeba histolytica is endemic in this eastern part. So whenever you will ask any patient, the patient appears to be a patient of Naxbhumika. in which out of 10, there may be 2 or 3 really Nux vomica, but the appearance, the symptoms of the patient will tell you like Nux vomica, because entamoeba histolytica like endemic there in these areas. So in this part, the people think that whenever my abdomen will be okay, my stool will not be constipated, my stool passes is regular, my bowel movement is regular, then I will be okay from everything. There no cardiovascular disease, there nothing, anything. So their thinking is like that developed. But right now, research and very evidence-based research come out that gut microbacteria, these are the main thing, maybe especially related to IBD, especially related to obesity, and which here is not mentioned, but the latest one meta-analytical research say that gut microbacteria is very much related to our all type of autoimmune disorders. So development of microbiome-based therapeutics and diagnosis from modern medicine, they are thinking we can also think of our bowel nosodes. We can think, so many research is going on these microbiome-based therapeutics from modern medicine point of view. We have to work hard on our bowel nosodes or constitutional treatment. We have so many bowel nosodes which till date we have not explored, but we have the symptomatology. But I know that all homeopaths we have not till date we have no idea about the potentiality or the efficacy of these bowel nosodes in these type of chronic diseases, even to autoimmune disorders also. Mental health regime, greater emphasis on mental health screening in primary care, digital tools for therapy, telepsychiatry, AI chatbots for counseling support. So you can think right now, these AI chatbots and telepsychiatry, our case taking part, we can make a app. We can create a new app with the considering the principles in all the principles of homeopathic case taking and etc. Which may also during taking the first doctor-patient relationship, that may be a very good our armor weapon for making the bonding with the patient, as well as we can get the true history of the patient. The counseling simultaneously may be initiated. So the very basic case taking may be our one part of simultaneous case taking in the very first visit. These we can with this help of AI or chatbots, we can make all these type of apps. So a mental health integration, how occur? It addressing mental health service as a common comorbidity of other disease. Medications available for use easily accessible. Proper training to diagnose and recognize mental health disorders. We can think of our aphorism of Organon. What are the moral remedies in under out of 10 disorders, you can find out that there are only 3 conditions in which medicine is required, and in other 7 conditions, medicine may not be required. So proper training to diagnose what is to be cured in the disease, whether the only moral remedies are sufficient, whether a good talk, good conversation is sufficient, whether empathy is sufficient for the patient, because abuse of modern medicine or homeopathy or Ayurveda, it is not at all desired by the medical fraternity. So communication and support between primary care networks and psychiatric specialists, very important part. So our Organon part, how whenever I think about our Organon philosophy and homeopathic philosophy, how superior it was since 200 years back, that can cause of moral remedy, that can cause of indisposition, that can cause of what is to be cured in the disease in a particular state. So these are so rich, affordable services accessible to rural poor communities. And I must say that your approach or our approach to the rural areas, to the remotest areas, to the urban areas, to the suburb areas also will be individualistic or community-based, social-based. There may be a group of remedies, they're like our genus epidemicus. It is not only effective for only epidemic part, it may be like a group-specific drug for a certain community, for a certain area, for a certain period. It may not be constant for the years, but for a time in that society, in that context, in that community, in that region, one medicine or group of medicine may be active for 3 or 4 months. So it will be only be work of a good observational study and research work. And it is a team effort. from the students to specialized doctors. Regenerative and cell-based therapies, they are now stem cell therapy for spinal injuries. It is in the modern clinical medicine, advancement in tissue engineering and 3D bioprinting. These are happening in the recent trends in clinical medicine. You can see the stem cell therapy, regenerative medicine therapy, and everything from heart, intestine, muscles, liver, brain, neurons, bone, cartilage, because you know that whatever cartilage, we collagen, hyaluronic acid, or whatever cartilage we have already damaged or lost, that cannot be again by any medicine. It cannot be done. Very little amount of can be regenerated, but it is not possible the same exact thing. The alternative may not be the main one. The alternative in the very, very minute form of the original one. So whatever we have lost, if we can regenerate it, even from modern medicine point of view and by our constitutional medicines, but we should know our real scope and real limitation in each case. It is not only very specific, our scope and limitation. This scope and limitation in one patient, we may see the limitations. In other patient, the same similar type of happenings may be the scope. So it is also individual based. It is also the basis of precision medicine. So never think anything fixed for scope and limitations. So integrative medicine combining traditional and modern approaches, and integrative medicine combines conventional medical therapies with alternative and complementary practices, focusing on holistic, patient-centered care, that addresses the physical, emotional, and spiritual aspects of health. These are the evidence-based practices from integrative medicine, emphasizes the importance of evidence-based practices by rigorously applying scientific research to alternative treatments, ensuring that they meet clinical standards of efficacy and safety and patients' satisfaction. I have observed that patient satisfaction with this type of integrative care, with the alternative medicines, with Ayurveda, Homeopathy, Unani, whatever we have in the Siddha, in Tamil Nadu area, a particular certain part, our region, even the yoga and naturopathy, everything, the patient's satisfaction is much more in comparison to the, I am not criticizing any system of medicine, but the patient's adherence, patient's acceptance, if you compare, whenever it will be holistic, the patients will be very much assured that I have the emergency medicine, I have also the very good type of alternative treatment. So the patient satisfaction is very much important part from a policymaker's point of view. And in this case, the integrative medicine are very good. Rationale for integrated medicine: chronic disease management, mental health and wellness, reducing polypharmacy. You see the third point, reducing polypharmacy and adverse drug reactions. So the increasing antimicrobial resistance or increased abuse of all the different generations of antibiotics, all these, it should be banned, like reducing polypharmacy. So our concept of single medicine, their concept of probiotics, our concept of no combination, they are also thinking of no combination, give one molecule at a time. So personalized and preventive medicine, the same thing, just the basic philosophy is the same. You see the overall health. We have social connection, exercise, good nutrition, dietary supplements, good 8 hours sleep, mind-body connection, keep smiling. And being a doctor, you also be a very confident one, just that you can influence your patient by your positivity, by your vibe. Your smile can influence, can infect the patient. Even the very Ignatia type of patient or very pulsatilla type of shy also can be very charged by consulting you, a man of homeopathy, that your confidence, your smiling attitude, your positive attitude, that can influence the patient's mind and body. Ultimately, that influence will act on his mind-body connection. And the very many type of lifestyle disorders can be cured in the very first visit, in the case-taking part, in the first visit with homeopathic doctors, with alternative treatments and conventional treatments. These are all overall health. And global health and equity focus right now, if we go through that, in Brazil, 75% there are no staff. It is from the internet. From internet resources are there that we have acknowledged all these data. 75% in the nursing homes, Brazil, there are very understaffed. The number of staff is very less. If you contrast to in just contrary India, from 2010 to 2020, suddenly surge of doctors, so many doctors, and percentage of doctors become from very low to good. We have now still we have only 1.8 per 10,000 population. This is our percentage. But the sudden rise in registered doctor in India from 2010 to 2020. So in all these areas in Japan, 24% one unequal part is there. There are from mental psychiatric doctors part, there are something lacuna. So these equity focus efforts to close gaps in healthcare delivery worldwide. So in one part, there is some lacuna. In another part, different lacuna. It is based on their geographical location and economy, etc. In South Africa, what is the most important part? That is all the healthcare, they have to depend on private medications, private nursing homes. But in private nursing homes, there are only 1% private hospitals or private nursing homes that can give you all type of drugs. There are scarcity of drugs. There are scarcity of available drugs. So the equity is something here in personal, in some country in relation to money, in some country in relation to doctor. So this equity is very much important. And we have a good partnership with Global Health Equity, the process and products. So healthcare policy and regulatory changes. Now, recent policy updates, healthcare policy landscapes are continually evolving, influenced by technological advancements. It is already told. Impact on clinical practice, policy changes significantly affect clinical practice by modifying reimbursement structures. These are also implying right now in homeopathic and alternative therapies. We are now reimbursement is making from the government part, from the private insurance companies, requiring adherence to new compliance regulations, which healthcare professionals must navigate effectively. And what is the future trends, or what are the future trends? Anticipating future healthcare policy trends such as telehealth initiatives, value-based care, very, very important one. Value-based care models and patient-centered regulations is right now, it is the challenge to the modern medicine. But from the very beginning, our homeopathic profession, we already patient-centered. We never say that pneumonia from clinical medicine. We know that pneumonia, the streptococcal pneumonia is a different bacterial, different parasitic. It may be pneumococcal, it may be parasitic, it may be of very much origin. But whenever from principal point of view, we have already considered the Mercury type of pneumonia or another type of pneumonia. Now they are focusing that one type of bacteria is giving one type of symptoms which is specific. The another Legionella is giving specific. So 3 to 4 symptoms for Legionella, 3 to 4 symptoms for another Psittacal, and 4 to 5 for other. So now they are dividing, they are making individualization in the disease. But we have already individualized the patient in a disease. Now the modern medicine has shifted their focus from the disease individualization, but now with this concept of precision medicine and patient-centered regulation, they are also considering the patient in the disease. So that very concept, that not disease in the patient, patient in the disease, it is now also the language of modern medicine. Innovative trends and strategies in innovative patient. What are that is the first one, value-based care. Very important. I'm not sure that whether all the junior one are very much accustomed with that or not. A shift focusing on improving patient outcomes over service volume. So whatever you are giving, if you say that I am your doctor and I am giving you a treatment and I will try for constitutional treatment and you will be cured, but after 1 year, 2 years, or whatever, 6 months, the patient is not getting any result from you, that is also not required. So the patient outcomes over service volume, this value-based care also you have to take care of. This is a very new one because to homeopathy, because homeopathy was thought of very only for poor man, or it may be free of charge like that. But right now it is going pari passu like that with modern medicine. Even the insurance claiming it is same in case of modern medicine. So value-based care, so patient outcomes, you have to think that whatever treatment you are providing and you are charging, so the value-based should be taken care of. Enhanced engagement using technology to boost patient interaction and education. Multidisciplinary teams, that should be core. There should be research team of researchers. One researcher cannot be a good doctor, and a good doctor may be a researcher but may not be a very critical researcher. So a team of researcher, a team of statistician, a team comprising of researcher, statistician, a good clinician, a good physiotherapist, a good psychiatrist, like that, whenever it is also individualized based, case based, in which case which team is required, that can be done by one good clinical clinician. This is very multidisciplinary approach. And mental health integration, it is already well known to us, and equitable access challenges. So these are the all innovative healthcare trends: AI diagnosis, personalized medicine, innovative mental health initiative, telehealth access. These are the all genomic advances right now, our miasmatic tendencies and constitution, like genomic advances, innovative therapeutics, digital and ethical consideration. And also there are advancement in clinical research. It is very, very, I am very pleased whenever I have gone through these 2025 papers, that right now research, the clinical research is also now thinking on the basis of personalized medicine, because in the concept of the golden standard, RCT, randomized clinical trial, the concept of individualization was in crisis. But right now, the clinical research also is thinking on effectiveness of precision or personalized medicine, on the epigenetics, on genomic research projects. So all these things, whichever was only in the philosophical part, right now it can be explained in the language of science. And research also, the research question, the research planning is also now doing on these basis. So it will be a challenge to research that. What it is very new. So what will be the outcome? The future may only tell this. So summary of friends, a synthesis of critical themes explored throughout this presentation, highlighting how advancements in telemedicine, personalized medicine, AI wearable and integrative approaches are converging to redefine clinical practices and implications for healthcare professionals. Healthcare professionals must embrace these trends to evolve their practices. This requires a commitment, very important part. Your commitment to ongoing education, whatever it is, not only in the form that we have made the syllabus new, it is competency-based dynamic curriculum, and whatever competency-based dynamic curriculum will remain on the paper, that not usually what it should be done. It is very important. Your commitment, what you are doing, your critical assessment of yourself is very important. Adaptability to technological innovations, also the adaptability, whether these type of techniques can be suitable to these also we have to think. Because everything, if we have no idea, we are thinking of individualistic concept, we are thinking of precision medicine, but the same concept we are applying in all the models, that cannot be happened. So like CBDC curriculum, also how to adopt with all over India, in all over state or in whole world, that also to individualize. Not only even not to individualize, group wise, region wise, college wise, economical wise, everything depends. So also it should not be also universal. It cannot be. It cannot be. So call to action for continuous learning to effectively navigate the transforming healthcare landscape. Professionals, you all, we are encouraged to actively pursue, for which this webinar is continuously has been running throughout so long. So lifelong learning. This is the online resources are here, collaborative discussions. These are all these 6 most important and very recent bibliography from where these are taken. And from homeopathic practice, the medical practice and the healthcare system, both are built on the foundation of the physician-patient relationship. We should have lifelong learning skills. The field is changing so rapidly that the need for continuous updating of knowledge and skills are essential. This is the CBDC learner-centered So our treatment become patient-centered, and our education, homeopathic education, now become learner-centered, activity-based teaching method. It is not that teacher will give only the deductive lectures in the classes and the students will take note of, and that will be vomited in the during examination. It is not part. The students will also get activated with the teaching, with the bedside, everything, examinations, even making the solutions of the questions, and on the field. Away from traditional teaching methods, students are not instructed to memorize and recite. Modern teaching methods emphasize learning objectives be made through classroom interaction, collaboration, active participation in engaging activities. And it is all, these are all to develop students' analytical abilities. It is not the only note reading and memorizing and vomiting. The life skills, sense of morality, critical thinking, you have to, from post-graduation first year or final year internship period, you have to develop your critical thinking. Why this is happening? Why should I do this? And why it is happening? Why professors are prescribing like this? What is the clinical approach to this? Why the patient is very much serious condition, having right-sided pain in the liver region, and without going through any very critical test, one doctor advised only straight X-ray abdomen in erect posture, and ultimately found one tented diaphragm and diagnosed as liver abscess. So the simple thing with the medicine that will go away, it is not the very you have to go for CT scan or MRI or anything. This type of thinking you should develop, where you should go through very simple, where you have to, a very complicated case, you have to go through very complicated way. In a very complicated way, it may not be true. Whatever you were thinking complication, and in the simple case, it may not be true that whatever you were very simple. So as a that is knowledge of clinical medicine will decide what step you will take on those cases. So methodology, flipped classroom, project-based learning, cooperative learning, gamification. Because your satisfaction is very important. If you can take your gamification with the organon, we know that all students are very they are very take interest in the rubrics hunting. They also take interest in the Metria Medica, Allen's keynote memorization. So like gamification part, if the students are very much engaged and get pleasure, so this type of gamification may be done in the chapter wise, in the subject wise. So different type of approach, problem based learning, design thinking, thinking based learning, competency based learning. And for this simulation based training, now it is whenever patient is abundant, patient may be abundant, but ethically you may not be touched, you may not be allowed to touch the all patient. So their simulation based training is good. And where patient is very lacking, in which hospitals or in remote areas, there also simulation based training is very good. Flipped classrooms, problem-based learning, and faculty development for modern teaching approaches. These are of very utmost importance. These are the very new concept. So the learner-centric, student-centric, differentiation and learning outcomes. These are three concepts of competency-based learning focuses. So CVME curriculum right now, it is going on. And the role of teachers must be like facilitator. So a medical graduate should be lifelong learner, a good clinician, a good observer, a good communicator. Integration, you should know the holistic concept, critical thinker, and team leader. Integrative clinical medicine and homeopathy with all these holistic health, dynamic cause, miasmatic dyscrasias, accessory. If we just like a model, if it may be like a model, this is a fatty liver, for free fatty acid is entering and make cholesterol. For making the cholesterol, there is phosphorylation for which choline and amine it is required. Choline and methionine. Choline and methionine is supplied from outside. So just to make a model of clinical medicine or physiology type, you can explain your organ and holistic concept that whoever is taking too many fats, the fat may be greedy, or too many fats may be due to not only greedy, he only knows these are the requirements. So I have to take these fats only. Without knowing anything, he is taking fat, and another one by greedy. So who is sorry, who is psychotic, who is syphilitic type? Also from desire we can think of like choline and methionine. There is absence of choline and methionine in one patient, there is one
Excuse me,
point.
sir.
I
Excuse me, sir.
will conclude. So from man in health to man in disease, multiple factors are there. So there are so many things which can be integrative approach for hoarseness to redness of eye. Redness of eye may be due to conjunctivitis, it may be due to rheumatoid arthritis, it may be due to autoimmune disorders. So many things. Very from integrative point of view, we have to think of genetics and epigenetic systems and teaching of medicine. So Materia Medica, medicine from Materia Medica, from repertory from teaching of Materia Medica from repertory, etc. So paradigm shift is there. So homeogenomics to PRS versus miasm concept is a new concept in clinical medicine. The polygenic risk scoring. So total genetic variants in an individual to assess their heritable or acquired risk. How many heritable or acquired risk? How many susceptible you are to the disease? So polygenic risk scoring is synchronizing our miasmatic dyscrasias, that patient having multi-miasmatic dyscrasias, so they are very prone to develop these diseases. These are the new concept, PRS, with our miasmatic concept. So this type of integration is required, and clinical medicine is going very fast, and their philosophy is encompassing also in crude sense philosophy. So we must be very updated with the clinical medicine, just to show the superiority of homeopathic philosophy in clinical medicine. And we should not remember that organon is a tool, organon is an instrument just to guide clinical medicine, how we should read that. So with this, I must conclude this, that clinical medicine is only way, and to remain updated with clinical medicine is the only way to be a good homeopathic prescriber. Thank you.
Yes, thank you, sir. A marvelous presentation, no doubt about that. The unfortunate thing is that majority of our professionals are not at all bothering about this. They only need some medicinal clues, which medicine to this case or that case. But this is a fundamental one, because, and of course, we are really lagging in these areas. That's what happened in the last 50 years. Otherwise, we should have more specialties and more experts and more centers in homeopathy. But that wasn't happened because of their conventional thoughts. Giving some medicines and practicing in a single clinic will make them everything. No, that will not happen. But your presentation is absolute one. Why I am talking about this? I not about the on comment. You please talk about the practical part. It is a theoretical part. One fellow is commented. But unfortunately, this is an important thing. Without this structure, we cannot advance. You just mentioned about the modification of the curriculum in our academics. Moreover, our students or younger generation should be able to talk, to address, to communicate with the professionals and administrators, what they requires, what their needs. But that wasn't happened for the last 50 years. Now, recent days, it is happening. I'm congratulating you. Ram Parvesh sir. Yes. And you can express a lot of thanks also, sir. Yes, please. Please unmute, sir.
Thank you, Dr. Manoj ji. And congratulations, Dr. Rajat Chatterjee. I am Dr. R.P. Supol. Very nice presentation, excellent session, and currently newly introduction in clinical medicine digital platform. And mental and physical health care is a very important. So, very thanks, Dr. Chatterjee ji. Thank you. Again, presentation, behalf of IFPH, again presentation.
Thank you.
Yes.
I will
Definitely, this is a professional because he is qualified in MBA, PhD, post-graduation, definitely. So that's why I'm expressing my anxiety is that we must study more and more. We should have more courses. Our brain should be ignited, otherwise it will not work. Because we know our master is an ignited person with an ignited brain, Samuel Hahnemann, but we are not able to follow him. That's the most important thing. With their comment, it will conclude today's English edition. Hope you that will be back again tomorrow. Till then, goodbye, and Dr. Mariama John to continue the program in Malayalam. Thank you.